Today we will discuss acute cerebellar ataxia, but really quickly. Are you fed up with lectures using complex vocabulary to appear smarter? Whether you're a current student or healthcare provider, doctor, nurse, or pharmacist seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. Acute cerebellar ataxia is a condition that affects your coordination and balance. It happens when a part of your brain called the cerebellum is not working properly. This can lead to problems like stumbling, difficulty walking, or trouble with fine motor skills like writing or buttoning a shirt. Signs you might have it: unsteady walking. You may feel wobbly or have trouble keeping your balance. Clumsiness. You might drop things frequently or have difficulty with a task that requires coordination. Nausea. Some people experience dizziness or a feeling of being unsteady. Speech changes. Your speech may become slurred or slow. How to know for sure? If you notice these symptoms, it's important to see a doctor. They might perform a physical exam and some tests to assess your coordination and balance. In some cases, imaging tests, like an MRI, might be done to look at your brain. And MRI stands for magnetic resonance imaging. If you have concerns, consulting a healthcare professional is the best course of action. If someone has acute cerebellar ataxia, here's what to do. Stay safe. Make sure they are in a safe environment to prevent falls. Help them walk. Offer support when they walk, like holding their arm. Encourage rest. Let them rest and avoid activities that require balance. See a doctor. Get them to a doctor for a proper checkup and treatment. Follow doctor's advice. Help them follow any instructions or therapy plans given by the doctor. Taking these steps can help manage symptoms and ensure safety. In the hospital, here's what doctors typically do for someone with acute cerebellar ataxia. They check symptoms. They will ask about symptoms and do a physical exam. They will run tests. They may perform blood tests or imaging like an MRI to find out what's causing the issue. Treat the cause. If there is an underlying issue like an infection or inflammation, they will treat that. Supportive care. They will provide support like helping with balance and coordination. They will monitor progress. They will keep an eye on the person to see how they improve. The goal is to find the cause and help the person recover safely. The treatment for acute cerebellar ataxia often focuses on the underlying cause rather than the specific medications for the ataxia itself. However, here are some common meds that may be used depending on the cause. Corticosteroids, such as prednisone if there is inflammation, antibiotics if an infection is present, antiviral medications if a viral infection is the cause, like acyclovir for herpes virus, immunoglobulin therapy. Sometimes this is used for autoimmune causes. So as you can see, ataxia can be caused by multiple different reasons, which is why the medications given for it are completely different from each other and all have different mechanisms of action. Always consult a healthcare provider for the appropriate diagnosis and treatment options. People at increased risk of developing acute cerebellar ataxia include children. They often get it after viral infections. People with recent infections. If someone has recently had a viral illness, they may be more likely to develop it. Those with autoimmune disorders. People whose immune system attack their own bodies may be at a higher risk. Those people are referred to as immunocompromised. Individuals with certain genetic conditions. Some inherited conditions can make someone more prone to ataxia. Overall, being younger or having had recent infections increases the chances of developing this condition. Now you need to watch my video on asbestosis or have a look at tracheal stenosis.